Hello, everyone, and welcome to the Mock Talk. This is Mark Valenti and Brittany Wilson.
Hi, everyone.
The Mock Talks are an approach to learning and development that really seeks to go outside the box and give you a unique experience that will give you a chance to learn and grow.
As a matter of fact, Mark often goes outside the box, even to win tic-tac-toe.
Very true. Thank you for calling that out, Brittany. And our Mock Talks are done through the lens of Motivational Interviewing, 3rd edition. And as you may know, Motivational Interviewing is about helping people change behavior. And it focuses on the special language of change, and the goal is to promote change talk in individuals that we're trying to help change. We're going to talk about the 4 steps of motivational interviewing. We're also going to talk about the concept that change resides within each individual. And if we're trying to help them change, we need to drop our bucket down and pull that change to the surface, much like a well with water already inside. We'll talk about the MI approach, which includes how to express empathy, promote partnership, soften, sustain talk, and cultivate change talk. We'll also make references to Daniel Pink's drive and the 3 levels of motivation. And we will definitely refer to the behavior change triangle, which says that people make changes when 3 things are present: knowledge, importance, and confidence. And what makes this unique is that Brittany and I will take the role of patient and provider, or boss and employee, and we really want to assess our communication and break it down and give you a chance to think about what we talked about. Because of the short time we have, our conversations are done in a sort of fast way. So in other words, conversations may be longer than this in real life, but we definitely want to do timeouts, rewinds, and time back in and try something different. Which leads us to today's case study, which Brittany is going to talk about.
Yeah, so for today's case study titled The Weight of Willpower, I'm going to introduce you to Karen. She's our patient. She's actually quite obese, and she's heading into her PCP office for just an annual checkup. She's got type 2 diabetes with symptoms of neuropathy and retinopathy that is impacting her vision. She also has a history of depression, and most recently, she was at a cardiologist appointment, and he had to increase some of her medications for her blood pressure.
And as we talk about Karen's PCP visit, the PCP office is unique because they really are focused on person-centered care. And the idea behind it is they really want to look at the patient and the families and the communities as holistic and think about mental, behavioral, all those things. And they really understand that it's individual behavior that has the greatest impact on health and well-being. So they weave a lot of conversations about health literacy and other things into their conversations to really focus on person-centered care. They also recognize that people struggling with obesity are stigmatized by society, and they try to be aware of that as well. Dr. Fixit is Karen's PCP, and he's super excited today because he found a new tool called the 5 A's, which he's going to try as an opportunity to have a conversation with Karen. He's so excited, he's talking to his nurse and medical assistant and med student in the office about how he wants to try these 5 A's, which is used by the Canadian Obesity Network. Not only is it used in Canada, but it's also used by multiple health systems in the United States, including the Allegheny Health Network and a Highmark Health company. So as we look toward Karen's visit, Dr. Fixit is extremely excited. So let's kind of tune in right now as we look at the conversation between Dr. Fixit and Karen. Karen, hello, how are you?
I'm good. Just here for my checkup, starting off my new year right.
Speaking of the new year, any resolutions?
Nah, I've done that before. Can't seem to stick to them, so why bother?
You haven't had any success because your willpower's down.
I guess.
Well, Karen, your BP is higher than your last visit, as is your weight. Can we talk a bit about your weight climb specifically?
I suppose.
So, Karen, how did you let yourself get this way? Do you overeat? Is it genetics? Have you noticed an increase in weight after medications?
I do have times where I eat to cope with things.
You eat too much and probably not healthy things.
Well, people who are sad don't go out and eat a pint of broccoli.
So, Karen, you have diabetes and it's impacting your vision now. Your blood pressure is really high and you have yet another medication added to what you are already taking. You also have depression and you continue to overeat. They have the therapist for that. We need to get your portions under control. And not only that, but you need to start watching your carbohydrates with your diabetes. You also need to get a little more active. If you continue down this path, you will surely die.
Okay.
Glad you're agreeable. So let's talk about how we can work together to get you on a better path. We want to make sure that our plan is realistic. You'll never be a size 0. And I don't expect you to get to the ideal weight or anything, but you have to lose some because your health depends on it.
I know.
Good. Now let's talk about some steps you can take to get started. I noticed you were munching on some donuts in the waiting room. So maybe you could just start by cutting a donut a day. It really is just a matter of setting your mind to a goal and sticking with it. It is easier if you make little steps. You could also start keeping a food journal to keep track of this stuff. It's really helped other patients.
Okay.
Okay, great. So I'm going to connect you with Nutrition Nancy from the clinic. She can help you make better decisions about your diet. Also, I want to give you Active Amber's number, who can work on some exercises that even you can do. Oh, and here's a notebook, but you can use it as a food journal. Make sure you bring it to your next appointment, and I'd like to see you in a month. Sound okay?
Yeah.
As we look 2 hours later, taken from SpongeBob, we see Dr. Fixit talking to his primary care team. And the nurse asks him how it went, and Dr. Fixit says, I'm super excited. I feel that Karen is actually going to make some of these changes, and I owe it all to the 5 A's.
Meanwhile, Karen, after her doctor's appointment, met a friend for lunch. And she's at her favorite restaurant, and Karen's friend is like, hey, what's that you got for lunch, Karen? And Karen's like, fruit salad. And the friend's like, kind of looks a lot like sangria. And Karen thinks, weird, and sips her fruit salad.
Okay, let's do a timeout and sort of see what happened there. Again, the framework that we're talking about is the 5 A's of obesity management that Dr. Fixit referenced, and it kind of provides a guide to having conversations about this sometimes difficult topic. The first step of the 5 A's is ask for permission to discuss weight. And as you can see, Dr. Fixit does ask permission. Can we talk a bit about your weight climb specifically? But the problem is he jumps right into it, and he's really not expressing empathy or promoting partnership. And what happens is if we follow different frameworks like the 5 A's directly and just jump right into things, you can sound like a used car salesman, just really asking questions without actually expressing empathy. And what really happened was Dr. Fixit neglected to engage Karen and just automatically went to his agenda. The second step of the 5 A's is assess obesity-related risk. And there's actually a tool that tries to categorize the different risks into metabolism, weight gain, increased food intake, and reduced activity. But unfortunately, Dr. Fixit jumps right into it, and he just asks question after question after question. And he's really using a check-the-box mentality, almost like an auditor just going through a list. So again, he's not really expressing empathy or promoting partnership. The next step is to advise. And he automatically jumps into this writing reflex and just starts talking about how the impact of blood pressure is there and depression impacts it and all these things happen. And he really advises Karen and just jumps right to it. And Karen is just like, okay. And what Karen is doing is just responding in the moment to Dr. Fixit and really just maybe saying what he wants to hear, which really focuses on extrinsic motivation as opposed to intrinsic motivation. And oftentimes when people are struggling with weight, we find their confidence is down. And when they're told time and time again what they're doing wrong and dumped information on them, their confidence goes down even further. The next step is to agree on realistic weight loss expectations. And Dr. Fixit does a great job of trying to talk about little steps. And oftentimes in healthcare, we try to push little steps on patients because it's actually a good idea to take little steps, but it's coming directly from the doctor, which is jumping to the planning stage instead of looking at Karen as the well and pulling up her ideas on how to move forward. The last step is to assist in addressing barriers and connecting to other people in the healthcare field. So again, Dr. Fixit tries to connect Karen to Nutrition Nancy and Active Amber, but again, it's coming directly from the doctor and not even pausing to understand Karen's perspective. So again, her confidence goes down as a result of it. She doesn't really say much during this conversation, so we don't even know where her knowledge level is in all of this. And as a result...
Yeah, so whenever she's at lunch, she is having sangria, but she's calling it fruit salad. So we see that Karen hasn't really made any behavior changes, even though Dr. Fixit thinks that she was pretty agreeable.
Yeah, and I think that's a good point. And as we talked a bit about the primary care office and Dr. Fixit, he is well intended. He's not saying anything so crazy in there, meaning like he's not yelling at her. He feels like he's doing a good job, but it's really about refining his approach to be more person-centered and expressing empathy and promoting partnership. So let's rewind and do it again, going back to when Karen starts her visit with Dr. Fixit. Karen, hello, how are you?
I'm good. Just here for my checkup. Starting my new year off right.
Tell me a bit more about what that means.
Well, as you know, new year means new me, and I've been considering making some changes, starting with attending my appointments.
You're making health a priority this year.
Yeah, I've struggled with many issues over the past few years, and I'm on all of this medication. I really feel it's time to get a handle on things.
Well, Karen, it sounds like you've given this a great deal of thought. You've mentioned some impacts that you seem to want to change. Would it be okay to discuss some of your specific health concerns as well as some of mine?
That would be really helpful. Sometimes I think about everything going on, and it's very overwhelming. I would really appreciate your thoughts.
Wonderful. Would you be able to share with me your specific health-related concerns?
Sure. I'm really concerned about all the medications I'm taking. I went from 5 last year to 7 this year. My blood pressure has been up, and it seems to get worse every year. I just want to get off some of these meds.
You want to improve your health.
Exactly.
What are your thoughts on how you can start doing this?
Well, I'm not exactly in the best shape. I really do not exercise, but I've heard that sometimes activity and nutrition can help with blood pressure.
You seem to know a great deal about your condition.
Yeah.
So, Karen, you've identified that you're wanting to make some changes to better your overall health, and you've mentioned that you think that increasing your activity and improving your nutrition might be helpful. Can we discuss this further so we can come up with a plan that is right for you?
I'd like that. Sometimes I know what I need to do, but I just don't know where to start.
Okay. Do you mind if I explain how we will walk through this and get your thoughts?
I don't mind.
To start, let's take a look at your current state. Your current weight is 325 pounds and you are 5'4". What do you know about these measurements?
I know that I am obese and that it is really putting a strain on my overall health.
You seem to know about the measurements and feel you need to make some changes related to your weight.
Yeah, it's really been weighing on me.
Do you mind if I share some additional impacts your current weight may be having on your health?
No, please share away.
Well, in addition to your blood pressure, it could also be impacting your diabetes. And as we've discussed in other appointments, your diabetes has had accompanying symptoms like your neuropathy and retinopathy.
Oh, wow. I really didn't think of that.
It's a lot to think about. So to summarize, we've identified that your current weight could be contributing to your additional diagnoses you have, like your hypertension, diabetes, and depression.
Wow. It seems like my weight really impacts everything.
It truly can play a big role. With the information we have discussed, our next step is to categorize some of these connected diagnoses to better understand the root cause.
Okay.
So your diabetes and hypertension would fall into a metabolic category. That just means the medical side of things and how it impacts your body. We also discussed your depression, which could fall into the mental category. By categorizing them, we can narrow down specific ideas that could help us create a plan for you. Thoughts on this approach?
Actually, I think separating them like this helps me simplify the bigger picture. It actually already seems less overwhelming.
Fantastic. Now that we've sort of bucketed some root causes, what are your thoughts on exploring the current impact they are having on your health and what we can do about it?
That sounds like a good start.
Great. So tell me a little bit about what you know regarding the impacts of your weight on your hypertension and diabetes.
Well, I understand that both of these conditions could improve if I get my weight down. My problem is I really have trouble with food. I just love food and I eat constantly. I eat it when I'm feeling down, I eat it to celebrate, and I even eat when I'm bored.
You find yourself eating more than you feel you should.
Absolutely. It's been a struggle my entire life.
Karen, you've been able to identify a great deal of things you may struggle with in this conversation. You also understand that by taking some steps to reduce your weight, it could have a positive and direct impact on some of your current conditions. What are your thoughts on how to move forward in this process?
Well, it seems that I would have to start with my eating habits. My portions are not appropriate, but I'm not sure how to start this. I'm really afraid of feeling hungry and failing.
You seem to realize the importance of balancing your portion size, and you have a strong knowledge base of the potential benefits. It seems you struggle with the confidence to carry this out.
That's right. It feels like so much change at once.
I'm glad you brought that up. And in order to make this a continuous impact, we should avoid making too many changes at once because that is overwhelming. What are your thoughts on some small things you could try to start this transition?
Well, when I eat regarding my boredom, I'm usually not hungry. I wonder if finding something else that I enjoy when I get in that state of mind would be helpful in avoiding a meal I do not need.
These are some things you feel you could try. How can I assist you in meeting your goals?
I'm wondering if you could connect me with a support group or someone I can talk to routinely about the struggles I face.
I have several connections. Based on what we talked about today, I think I would recommend connecting with Nutrition Nancy. She specializes not only nutrition, but other supports that may be some of help to in your specific situation. How does that sound?
It sounds like this plan is really what I need to be successful.
Here is her information. Also, to ensure we're working on this together, would it be possible for you to come back in 1 month to discuss your progress and any other concerns?
Certainly. See you next month.
Okay, let's do a timeout and assess what happened. Through the framework of the 5 A's, Dr. Fixit has a chance to really connect all of this to more of a motivational interviewing approach. And when Karen starts talking about what she's doing for the new year and just starting the conversation, instead of jumping immediately to the 5 A's, he says, tell me a bit more about what that means. And Karen has a chance to talk a lot more than she did in the first scenario when we had it done the first time. And in this case, Dr. Fixit is really expressing empathy and really trying to understand where Karen's coming from. He's also promoting partnership by giving her a chance to talk. And after she talks about it, she actually has some change talk, and he identifies that and says that she's making health a priority this year. And when she says, I really feel it's time to get a handle on things, that's Karen expressing her change talk and saying that she feels that it's ready to make some change. And again, focusing on the change talk is the goal of motivational interviewing with Karen as the patient, as the person, verbalizing her own reasons for changes, which is very powerful. At that point, he talks and asks permission to discuss weight. He specifically says, would it be okay to discuss, at which point Karen talks about it. The next step, of course, if you remember in the first example, is assessing obesity-related risk and going through that chart. But instead of giving her the chart and saying, here's what it is, or here's the question, are you this, are you this, are you that, as we talked about with sort of an auditor, he asked her perspective on what her thoughts are on how she can start doing this. At which point Karen, because she already has the change inside of her, talks about her ideas, but also has some uncertainty. But instead of just jumping to all these list of questions and focusing on these 3 areas, he asks her perspective, which has her feeling much more like it's a partnership. At that point, he breaks it down, talks about metabolic and mental, and trying to focus on a health literacy perspective, explains what those things mean. At which point, Karen talks about the benefit of what he just said and says it actually has helped her understand. At this point, he transitions to advise on obesity risks and really focuses on expressing empathy and promoting partnership, and breaks it down and then asks her, what are her thoughts? So if you notice, Dr. Fixit, as he explains different things, pauses and asks Karen her thoughts, at which points it really promotes that agreement and moves forward to realistic weight loss expectations. And he actually affirms Karen and says it can be overwhelming. We should avoid making multiple decisions. So again, he stops and asks her thoughts on some small things. Instead of saying, here's the small things you should do, if you remember in the first example is about 1 donut a day, he asks her thoughts on small steps. And he actually says, here's some things you can try. And then he asks to promote partnership and asks how she can assist. At which point she actually asks to be connected to those other people, Nutrition Nancy specifically, and he helps make that connection. So what are some of the challenges? You probably noticed that it takes a lot more time in the second part of it. Although if you go back and re-listen to this, you see it's not that much more time. But again, the question is, how do you use your time? Does it make sense to keep doing the same thing over and over and over again, and people struggle with making changes and they end up in the hospital or worse? Or does it make sense to have a meaningful conversation now to promote that confidence so people can start making realistic, self-sustaining changes to their life? The other part about it is it's not all up to the physician. If you're looking at a truly transformed primary care office, then other people would have these conversations with the individuals and their families to promote that change. So this has been the mock talk for the weight management issue. This is Mark Valenti and Brittany Wilson.
Have a wonderful day.
Yeah, thank you very much.